Transportation and outsourced activities. This presentation will focus on the expectations around outsourced activities and transportation. In this presentation, the following will be covered. Under outsourcing, a look at supply chains, examples of outsourcing, what the GDPs require, responsibilities when it comes to outsourcing, and some common deficiencies. Under transport, we will look at the associated goals, risks and success of a transport system, why the product needs to be centre, a brief look at the qualification of transport, and some common transport deficiencies. Outsourcing and why it is important. Before we look at outsourcing, we need to take a look at the supply chain. A supply chain involves a number of parties to get a medicinal product from the manufacturer to the patient. The simple pharmaceutical supply chain involving a manufacturer, a wholesaler, a pharmacy, and a patient are probably more of a rare occurrence these days, with many different parties now involved in the supply chain of a medicinal product. Different parties are not evident in just one part of the supply chain, but could be found throughout the supply chain, but can also be based throughout the world. Many supply chains today are global, and this adds to the complexity, but also the risk of the supply chain of a pharmaceutical product. As the pharmaceutical supply chains become more complex, it also means that a lot more wholesalers are relying on other companies to carry out work on their behalf, and this is outsourcing. If you are outsourcing a GDP activity or part of an activity, the GDP guidelines require that agreements are in place and audits have taken place so that you can be confident that the company acting on your behalf is carrying out the activity as you would like. It is also to ensure that the risk to your operation is minimized as you have oversight of their activity and how they carry out these activities. So what constitutes as outsourcing? If you have another company carrying out pest control, validation, maintenance, auditing, cleaning, calibration, temperature mapping, if you hire contract or temporary staff, waste service, transportation or storage, these can be examples of outsourcing. If a company is carrying out storage for you, then they must be appropriately authorized to do so, and this is your responsibility to check this. For storage of medicinal products, a company must have a wholesale distribution authorization. Here are some further examples of outsourcing. Subcontracting work to another company, calibrations or temperature mapping, arranging for somebody outside a company to do work or provide goods for that company. So maybe a sister or affiliate company performing activities on behalf of your company. For example, auditing or the qualification of suppliers or customers. Another example of outsourcing is obtaining goods or a service by contract from an outside supplier. For example, contract storage or transportation. Let's have a look at what the GDP guidelines say about outsourcing. Outsourcing is any activity covered by the GDP guide that is outsourced, should be correctly defined, agreed and controlled in order to avoid misunderstandings which could affect the integrity of the product. There must be a written contract between the contract giver and the contract acceptor, which clearly establishes the duties of each party. The contract giver is responsible for assessing the competency of the contract acceptor to successfully carry out the work required, and this should be done through audits. So what does this mean for you? Here we go through the key points in relation to responsibilities of the contract giver and the contract acceptor. The contract giver should ensure there is a written contract in place covering all outsourced GDP activities. They should assess the competency of the contract acceptor by auditing before entering into the contract, for any changes to the activities contracted, and then routinely, and this should be based on risk. The contract giver should also ensure the principles and guidelines of GDP are followed, and they should provide the contract acceptor with all the information necessary to carry out its duties. The responsibilities of the contract acceptor. The contract acceptor should have adequate premises and equipment, procedures, knowledge, experience, and competency. It should have the appropriate authorization if required, for example, a WDA if storing medicinal products. The contract acceptor should not subcontract any contracted activity without the contract giver's prior approval. The contract acceptor should refrain from any activity which may adversely affect the quality of the product, and the contract acceptor should forward any information that can influence the quality of the product. Here are some of the common deficiencies that were found during the GDP deficiency review. 21% of the major deficiencies given against outsourcing were in relation to no quality or technical agreement being in place, or that they were missing information. Having a quality or technical agreement is a requirement of the GDP guidelines. It is important you review all your outsourced activities to ensure that this agreement is in place. All the activities relating to GDP and wholesaling should be captured in this agreement, and also what you expect from the company. For example, if they are holding for you, do you require notice of temperature excursions? Or if they receive a complaint, do you expect them to notify you? In relation to audits, make sure to review the areas that are important to you. If the company are going to be holding, review the storage area. If the company handle complaints, look at how they actually record the complaints and their process around complaints, and are you happy with it? If you choose to perform a desk-based audit over an on-site audit, you have to risk assess and justify it depending on the activity the company carries out for you. If they are cleaning, are they meant to be on site for 10 hours a week, and are they completing this? Are they transporting your product correctly? This is the information that you should be looking to verify in your audit. As transportation tends to be a highly outsourced activity, this is the next section that we're going to look at. Why is transportation important? It is important that you don't think that once the product has left your premises, it is no longer your responsibility, as until it reaches the patient, it is in the supply chain. Therefore, if you are responsible for transport, you must be aware of the risks. Transportation of medicines is a high-risk area due to the variability of a number of factors that can be out of your control, such as the weather. However, this risk can be minimized by understanding your transport routes and your systems. The goal of any supply chain is to transport products from the manufacturer to the consumer. The two greatest risks to the pharmaceutical supply chain is product risk due to theft or damage during transport, and the risk of non-compliance with regulations, guidelines, and standards. And this is increased further due to an increasingly complex supply chain. The success of a pharmaceutical supply chain depends on and is measured by its ability to deliver medicinal products safely with its efficacy fully intact to the patient. Putting the product at the center. The success of a transport system is the patient receiving the product as it is intended with its full efficacy. What do you need to consider when transporting? One thing you need to consider are the storage requirements of the product. You need to consider transportation as a continuation of storage. Where can the storage requirements be found? These can be found on the outer carton, on the product label, or in the product information. Some of the typical storage requirements are depicted on the slide. For example, if your product states do not store below 25 degrees and do not refrigerate, This means you have a temperature range of 8 to 25 degrees in which your product should be stored and transported. A survey of authorized products found that approximately 51% were ambient products, 31% refrigerated, 17% frozen, and 32% stated that they weren't allowed to freeze. These storage requirements are important to be considered during storage and transportation. Please note that the storage requirements are defined in a product's marketing authorization, and therefore failure to meet this was given as an example of a major deficiency, as this is a high-risk area for public health. Before you ship any medicinal product, you need to have a qualified transport system, and here are some points to consider. The first step is to know your product. What are the storage conditions? Do you need to take into account any sensitivity or stability issues? What is the presentation or packaging that you are dealing with, such as cartons, bottles, glass vials, as this will all have an impact on transport. Therefore, understanding your product is the first step in a qualified transport system. Next, you need to consider the available logistics provider, whether this will be an external company or the transportation will be provided internally within your own company. Do they have the capability to transport the product under the necessary requirements? If external, have you audited them and is there a contract in place? Risk assess. You need to carry out a risk assessment on the transportation, not only in relation to product requirements, but also think about the route, the environments the product will be traveling to, the duration of the journeys, the effects of the seasonal extremes on the product, and the different shipping systems that are available. Once you have decided on the shipping system, whether it's a passive shipper or active transport, you need to validate your chosen system to ensure that it performs as you require. Your initial studies should be your operational qualification to check that your system works as expected. If you are using the manufacturer's qualification, you need to ensure that you follow their instructions regarding the conditioning of ice packs and seasonal configurations. Following your OQ work, you need to carry out a performance qualification. This is shipping under real conditions. We recommend you test your longest route or the route with extreme conditions with min and max loads during summer and winter. This is all about gathering data to give you confidence in your chosen system that it can deliver the products under the required conditions. Once you are happy that your transportation system can do what you need it to do, then you need to gather all the information to put controls in place so that the transportation conditions can be met and are repeatable. The controls should be in the way of developing SOPs and forms on transportation, pack-out instructions, training of staff in these SOPs, or possibly using continuous temperature monitoring. There is no point in a quality team knowing how long the ice packs needs to be in the fridge prior to packing if the operator in the warehouse doesn't know this, or what the set point of the fridges and freezers are unless these are placed into procedures where they are available in case they are required. Also, a plan for ongoing monitoring of your transport system should be developed, including audits of transportation if outsourced. Remember, if you outsource the transport, you are responsible to ensure that the outsourced transport provider can meet your product's requirements, and we will look for evidence of this. If anything changes in this cycle, you should reevaluate your transport qualification to see if you need to carry out a further qualification. Make sure to document exactly how you did your qualification so that you have the data to review in case a deviation occurs. Here are some common transport deficiencies. Some examples of major deficiencies are no validation or risk assessment was performed to assure the quality of the medicinal products will be maintained during transport, insufficient validation performed, or routes were not validated. Deficiencies of this type were seen in 51% of the major deficiencies given against transportation. 23% of the major deficiencies given against transportation included deficiencies around temperature excursions and the handling and preparation of shipper components and pack-out instructions. In relation to other deficiencies, some of the examples of other deficiencies include the mapping study was not carried out correctly, not all trucks and trailers were temperature mapped, mapping reports were missing information, and also issues around procedures and technical agreements. Some take-home messages from the presentation. In relation to outsourcing, make sure that audits and contracts are in place. In relation to transportation, ensure that you have a qualified transportation system. Remember that it is a dynamic environment and that with every change you should review your transportation system to ensure that it's still valid for your requirements and, more importantly, that the patient is receiving the product as it's intended to be. Thank you.